Myself, Ambali V. Vijayakumar, working in Carl Institute of Nursing, RL University. I am welcoming Mr. Emil Enu, today's eminent speaker on the behalf of Carl Institute of Nursing, Carl University. Welcome, sir. About the speaker, he completed his BSc Nursing from Mahatma Gandhi University and MSc from Rajiv Gandhi University of Health Science from Karnataka and pursuing PhD in IIHM. Having more than 30 years of experience and currently working as a senior nursing superintendent in the Southwestern Railway. Honors to have so many awards and recently awarded from Southwestern Railway GM Award. More than 12 Scopus Index publications and written author of 3 books and welcoming sir to the first we have as a speaker in the webinar. Welcome, sir. Once again, we are honored to you have a speaker like you, sir. Welcome, sir, for this function.
Yes, Ambali, thanks for giving us small introduction. So it's nice to be a part of your this thing on the sections, and so I hope everybody is safe during COVID-19. And we are working day and night for the resolution and everything. And thanks for providing an opportunity to present on this topic regarding that COVID-19 related issues. So hope everybody is audible.
Yes, sir.
Yes. Okay. Can I continue?
Yes, sir.
So rather than a continuous on academic session, I am more interested to share what are the experience, what we have faced, and the topic which I am doing my doctoral study also is related to the COVID-19 pandemic, how it is affecting that psychological aspect of the healthcare professionals. That is my area of interest also. I have selected this topic since long before the pandemic, and we were not expected that such situation will occur, whether that we are going to face such a situation. Anyway, we have seen, and it is an once in a lifetime opportunity of a health professional. Maybe our present professionals may see it in the recent future also, but I hope this our after the Spanish flu, it is like an we can't say it's an outbreak, it's like a clear pandemic. So I would like to share some thoughts about how that health system is resilient to the pandemic. That means we are facing that second episode of this pandemic, and we were in a verge of maybe the third one. We don't know exactly. So I thought this is a topic is somewhat relevant to that current scenario. Okay, so may I go ahead with that presentation? See, the thing is, the term resilience itself, it's a somewhat like a contradictory, and we are not much familiar with that term resilience. Even when I started my doctorate, guide was there, Dr. Needu Purohit. She's from Stanford University. She has completed her psychology graduation, and she's working in John Hopkins University in the US, and she's my guide. And she was told, why can't you do the process on case study, or that your process, your research on resilience of healthcare. I was not digested what that madam is telling. I was in a confusion what it is like that. But once we started facing the situation, we come to know what is that resilience, how our health system is preparing for or the health system is adapting that particular pattern, or that the way of treatment, or the way of our day-to-day activities. And still one more incident I will just share you. When that COVID was initially started, that the term PPE, that was first, the term PPE I had heard only when I'm in the first year BSc nursing classrooms, like the personal protective equipments or personal protective measures that we are using for prevention of contamination, everything like that. But when I got the first PPE kit, I was like a kid, just like my daughter. I am getting some toy, how to use this one. So like it's like a curiosity. Then that curiosity has turned into a mandatory. Then it is like that friends used to, what you're telling, that it is like you are inside a rice sack. That was the initial comment regarding the PPE and all. So just what I want to tell is how this pandemic has been affected our healthcare system, and how we are managing, and how we are overcoming that one, and how we are facing the second episodes and everything. So first, before that, just I want to tell some few times, like what is burnout, and how it is, what is the relation between this pandemic and burnout. And in ICD-10 classification, as we all are health professionals, we be familiar with that ICD classification. As per the latest classification, even burnout is termed as a clinical diagnosis, and this clinical diagnosis most of the time applicable to the health professionals and especially for the nurses. But whichever the case studies or the case presentation, what we are seeing in the Western world, the sample or that sampling criteria or the population which we are studying, that will be the nurses. They're the most vulnerable group, and which they can able to come to a conclusion, or they can have a study regarding that what it is exactly, what is the dimensions of a particular problem, how it's existing, how a health system is responding, that we can measure through the study regarding the nurses and the physicians. So on those are working in the clinical side, those are working in the administrative side, those are working in the teaching side, those are in the clinical administrators, there may be nursing administrators, there are the hospital administrators, some people are policy makers, some people are like a only as administration, they were dealing with health professionals. All were in a stressed out, or they were like they were in a verge of an explosion, and that most of the people, around 80 to 90% of people are finding difficulty to cope up with new scenario or the new situations, and it has changed their whole world. And as per our interpretations or what we are going through the literature and everything, so the thing is to overcome the stress, it is induced from the working environment, it is induced from our family side, or it is induced from that day-to-day activities or what we see in the new environment, that everything has to be, we have to overcome to perform or to extract that actual capability of an individual or health professionals. So my main objective regarding this talk is to identification of the burnout and stress, and what are the causes of burnout and stress, and how it is causing, and how the resilience is acting, or how it is developing, or if the how the resilience is happening, and how it is helping or promoting to overcome the current scenario. That is my objective of my this talk. So just we can go through what is the stressors. So I'll tell you, I'll narrate how we have overcome or how we are going through this pandemic. So I told you, when we are seeing the first PPE kit, it was like it's a child's curiosity. So we are getting a new cloth, new this thing, what is that, a toy, or we are getting a new paper, or we are getting maybe we can say it's like a greeting cards, whatever it is. So that was that curiosity was there. That curiosity was lasts for only a few weeks. Then that curiosity turned into a part of our life. And when we started using that PP kits and everything, previously we used to work for 8 to 9 hours or the 10 hours per day. Now suddenly with that particular personal protective materials, we can't able to hold our breath, or we can't able to withstand more than 4 or 6 hours with that PPE. So naturally that work overload has been increased, and our physical problems are arised, and staff shortage. If I'm assigning on staff for next 4 hours, next I have to find out one more staff for next 4 hours. That staff shortage has came. Then the physical aspects, it is more than physical aspect. There is a psychological problems, and physical aspect in low dehydration. All the things are popped up, irrespective of male, female, whatever the gender. This thing, all are having their own problems and everything. And we are isolated from an environment where people are fear to come. That means we are dealing the place where COVID patients are there, or any contagious diseases are there. So there is a natural problem with the family, that society, and we are seeing the death, and there is no medicine, there is no cure. So this everything has triggered like a physical, emotional, like a psychosocial. You can say like we are facing that like an isolative environment. Next, we are seeing the death, and the people are coming, the youngsters, they are coming with a low saturation level, and they are struggling in our ICU. We can't able to do anything, and lack of ventilators, that everything has changed, and that has invariably that has affected the normal mental status of an individual, the health professionals. And around 90% or 99% of the people, those who are listening, they can really correlate their life events or the life instance what has happened during from 2020 to as of day, and still we are facing the same thing. So these are the common stressors what we are observing, and that family, this thing, we are separation from the family, and we are living away from the family to take care of the patients. And sometimes what we are giving our effort also 100%, we could not able to cope up what we are expecting. That the demand is there, but we that self accomplishment or the self satisfaction was not happening. So that is all of the things what we are facing in this COVID-19 management. And the next the time will come the burnout. Burnout is a byproduct of a stress, we can say. So stress is an essential thing. So well, before that coming that what is stress, what we are facing, we are facing stress day-to-day activities. I say I'm daily facing stress, even I'm presenting the class, I have one more screen in my nearby, so I have to complete my all my surveillance activities, that everything that is having deadline, and that publications will go like what is our status, that everything, what is our conditions, then how we can make out our bed for the patient, how I can distribute my patients to another hospital where I can get the more facilities. So it is like a day-to-day activities that itself contributing a stress. But stress is essential for the manage or to go through that daily activities or the work. Stress is an important factor, but the problem when it happens, how we are controlling the stress or how we are managing our stress, whether it is managing in a productive way or the point, or we can say that tip in a particular tip. So suppose we are bending a pencil, it is very difficult, we can't bend, but if we are bending for a particular period, it may break. So this is the same thing applied for the stress also. So we can say it is like a stress will tend to the distress. That distress itself, we can say it is somewhat like a burnout. In a one point of time, our maximum capacity, ability, everything has been made a full stop, and that expected outcome over our productive activities, everything will get altered because of this burnout. So the management of burnout or the effective management of stress management, it is essential to overcome this COVID-19 management. Not only COVID-19 management, any type of management, it is an essential factor. Okay, and the important thing, do you stress out or I am stressed out? To find out that will take, that is, it is like a self-actualization. So what phase I am going through my life? So what are the things I am compromising for that management of the COVID or any type of pandemic or any type of activities? And next one, that one interesting factor is called a synergic effort or unfinished task. That it is an important point when you are talking about resilience. So I came to the hospital. Just imagine I am doing the work at 10 to evening 4 o'clock or evening 5 o'clock. I may be assigned around 100 works, or I might have seen 100 patients. 98 patients may be happy, but two people might be arguing with me, or two people are not happy with my service, or two people are not satisfied with my service. Or suppose I assigned for 100 work, I might have completed 98% of my work. Around two work I could not able to complete. Why means maybe the time constraints or my physical constraints or any type of things that is affecting my, that should not be affected my mental status. When I'm leaving my work and I'm reaching my home, that the thing which haunts me is that 2% work or the two tasks which I could not able to complete. So it's called synergic effect or the unfinished task. That is the main thing which contribute burnout or the stress factor among the employees or the healthcare professionals, whoever it is. And the perceiving of this particular aspect in your professional life, it is very important while overcoming the stressful effect. Stress management or the burnout management of it, it has to start from inside. And when we come to that the management of burnout or how we develop this thing, resilience, we can make a particular concept. It's a system. It's a, when you are, it's a hospital or the healthcare, it is developed, it is derived from a system. It includes myself. So any health professional, it may be a nurse, it may be a doctor, it may be a lab technician, whoever it is, even my cleaner or my attender or my safaiwala, whoever it is, all are coming into a system. That itself is self. And we all are working together in a hospital or a health setup or a community or either in the clinicals, whichever the place, that we can call it as a hospital. And this hospital also a part of a community. So I myself has contributed to the hospital, each hospital is contributed to the community, and all the community is for the healthy well-being of the individual. So first, when we are managing about that resilience or the resilience development or the burnout management, first we must understand self. Who am I? Or it is possible for me to resolve or resolution, the resolution for self-resolution or self-management of my anger, my emotions, my normal routines, that everything I have to ensure how I am able to cope up the present scenario. So I am a part of hospital. So when we are managing a pandemic situations, the primary thing will start from self, but the tail end is a community. So community also plays an important role, where which that community include that administrators, politicians, judiciary, that executive, everything has contributed to a part called community. They are making the guidelines, they are forming the guidelines, they are implementing the guidelines, they are supporting the hospital, they are supporting the healthcare activities, they are searching for the new resources which is required for the healthcare of population. So that community or the policy makers, which in that community level, they are helping to reduce the stress of myself directly or indirectly. So each and every individual or each and every part of the system which contribute something to manage effectively or to help the perform an activities of health professional effectively to manage a COVID-19, or even the term COVID-19 itself, it is just like a sign, but in a broader aspect, how to manage a hospital, how to manage a pandemic situation, or how to overcome, to minimize the mortality and to increase the health and well-being of the individual. So all together, cells, hospital, community, everything is working together to accomplish a same goal. So while talking about the stressor or the burnout, all these three aspects plays an important role. What is resilience? The process of adapting well in the face of an adversity. Here the adversity is naturally that COVID only, and the trauma, tragedy, threat, or significant source of stress such as family relationship problems, serious health problems, workplace or financial stressors. So everything is contributing to a stress level of an individual, and the resilience will form. It is naturally, it has to occur. But from our side, we have to contribute many things. And when we're talking about resilience or that adaptation or the stress or what we're telling, the burnout, that communication, that is an important thing which is placed in a management of an pandemic. How communication? For an example, I am visiting a supermarket or a store. I want to purchase one packet of bread. So I went there. The shopkeeper, I asked, I need a particular brand of bread or whichever the bread is available. I have purchased. I came back to my home. That person was very this thing. Genuinely, he was caring me. The way of talking was good. He has helped me for finding that particular bread or whichever it is. So that billing process was good. He was very happily. He has packed and given me, and he has given me the bill very happily. He has sent me home. So when I'm reaching home, I'm saying that the bread was maybe it is getting some fungal infection. Oh, sorry, that fungal growth or mold or whatever it is. So naturally, I have to return that particular product, and I'm approaching that shop, and the person was very happily. He's accepting, and he's saying sorry, and he's replacing that particular product and giving me another one. So I'm happy with that entire communication. So the process is going, communication was smooth. Just see the scenario where I went for the shop. The shopkeeper was not cooperative. I myself was searched for a bread, and they had given me the bread. And after that, I went for the billing process. Billing was in a long queue, and they could not able to provide me that right service. Even the purchase then came, that the bread was this thing mold format was there, or any fungal thing was there. Again, what I'm going back, the person was initially was not accepting. Then I'm talking about the customer laws, customer rules, everything. At last, he has replaced me that bread. So the pattern was same, but the starting and end is also same. But the problem, in that first scenario, I'm happy. I'm as a customer, I'm very happy. The communication was good, even though some problem has happened, I'm satisfied. But in the scenario two, the same thing has happened. I purchased, I brought to home, it is damaged, they got the replacement. They have given me the replacement. The things or the outcome, the source, everything is same. But the process or the communication or that attitude, what has happened through the course of action, it is entirely different. So in burnout also, in healthcare professional, it is an important part, the communication or that personal satisfaction of an individual, that also will help the outcome or the burnout factor of a healthcare individual. You may be doing the work 100%. The person A and the person B is doing the things very correctly and particularly. But the person A, the way of approach, the interpersonal skills or the communication, that also matters in the formation of a or the in the management of a stress. And the second thing, when you're talking about the burnout, stress, whatever happening in the healthcare system, practically it is many of the health professionals are finding difficult to cope up with the situation. Even I can correlate myself. See, I'm working for the hospital and spending around 13 to 14 hours per day for activities. I know I'm very much aware that it is not good for my health, and it is particularly it will affect me for the long time, and it may develop insomnia, many type of things which I am facing. But even though, but the problem for the management of a pandemic, many health professionals put their mind, life, everything inside the system to overcome this particular scenario or to make the system. See, the phone calls will come, midnight calls will come. That midnight they are calling for the bed, and midnight the people are asking for the shift, availability of next hospital, that oxygen shortage, then availability of limited resources like cylinder, then even for on oxygen mask, someday we have to search for the place where I can get it. So in that scenario also we are facing. But the resilience are happening. That is why that first episode of COVID is something different from the episode 2. That our health system is ready, and our staffs, even myself, all our colleagues, everybody is ready. Even we have faced the worst, and we are ready for the worst. But there is a hope. We have experienced that particular stress, and we have the confidence. Okay, we can overcome, and we will come through a next level. So that is what that stress and burnout side we are telling, and that coping mechanism, how you are coping with the particular environment. It may be a negative coping and there will be a positive coping. The person, the healthcare professional, they are coming out of the home and they are coming for the work, and they know they themselves may get infected. It is having many aspects: psychological, financial, and their environmental effect. Like on incident in Karnataka, few of my colleagues from a government medical college, what that on complaint what they are told, their community is not accepting them, and many of the places where they are coming, so they are that community is not allowing them to go back to their houses. What they are telling, you are working with a COVID patient and the environment is bad, and you are coming back to home and you may infect us. That was a horrific experience. They themselves has put their life under risk and they are going back to the home, and the community is not accepting them. So the psychological trauma which they are facing, which we are facing, it is we can describe that situations and everything. So how they overcome? So there that role of the community comes, rather than a self or rather than a hospital, the role of community will come. So to protect myself or to protect an individual or a healthcare professionals, that community is playing. That community leaders or the politicians or that higher ups like administrators, everyone was intervened. How to protect that particular individual or particular health professional to avoid this type of stigmatization which is happening in the community, so that they help. Second thing, some areas the community could not able to make one particular resolution. There comes the role of hospitals. The hospitals were arranged that separate bed space or separate accommodation for the staff, which they are going for the critical care areas. They made the room, they made the food, they made all the arrangements, they made all the arrangement for day-to-day activities or their staying or everything for an individual or for an health professional, everything they have made. They are the role of healthcare administrators here. So without that entire system, a health professional, it is very difficult to manage a pandemic situations. So to overcome, we have some ideas like we can have a good exercise, we can have a sleep habits, and we can have hobbies, and we have to follow the safety guidelines. And we have to, so many of our colleagues, like especially the senior, that everything they were maybe having some disease like the diabetes, hypertension, or any other comorbid conditions. They are requiring some type of medications, or they may be on regular medication. That everything they have to continue. And many of the time when we are in the PPE kit, I'm seeing all my colleagues, they are suffering, especially like females. Even they can't that even their menstrual cycle, even that is getting affected or hampered by because of this usage of this PPE and everything. That very well we can understand. The thing like a physiological need or the physical need, even that is getting hampered because of this management of this COVID and everything. But we are overcome and we have find out the solutions and that correct usage of medicines, because the comorbid condition itself will trigger. Suppose you got infected with the COVID-19, you are having with the comorbid condition, the mortality, everything will be is extremely high. And when it comes to the role of the community or the community leaders, so when the vaccine has been arrived, they had given the first preference to the health professional. It is the way which they can protect the entire system by protecting a health professional. So there the community has played a role. So community, hospital, ourselves, so it is we conjointly made a system. They are helping each other to maintain their normal psychological, physical well-being of an individual. So like that we have managed. So the effective management of community, hospital, or the entire health system has helped an individual or a healthcare professional to cope up a particular pandemic or to make them free from any the point or the tip called burnout. So this everything has helped for a successful management of a pandemic situations. And we have observed one more thing like a separation anxiety disorder, and many of the staffs we are having tantrums in their workplace. We have observed and we have seen also, and we have a lot of interactive sessions, and we had online meeting, we have virtual meetings, and we had like a interpersonal meetings, and we are having a small clinical meeting. That it is to relieve the problems, or it is like a platform for sharing their issues. That everything we have made arrangements, that everything. But even though that separation anxiety, especially from the family, see, I had gone through a series of episodes which we may fell into a depression episode. I'm separate, I'm not separate, I'm temporarily separate from my family. I have a small kid, it is hardly 30 or 40 days old. I have made them to stay there in her house or my wife's house because I know I may get infection at any point of time. I have a compromised child. So if the child is getting infected, I don't know how to manage with that new situation. And my wife was pregnant, this thing, she was COVID positive in her during her pregnancy. There we had a lot of sort of this thing, psychological trauma, how we will manage that, everything we have overcome. And that resilience, it has not manufactured, it has developed itself. How the way of we are faced and everything, the situations, and how that our community or our society system or the environment has helped us to overcome this particular thing. And but it is not happening for the even a small percentage of people. The resilience or their that positive adapting or the coping mechanism may not work effectively. Like an incident I'm remembering in the news, that one healthcare professional, that I think a doctor, when she has tested positive for COVID, she has jumped from the window and has committed suicide. The mortality among that youngsters below 30, you are a health professional or whoever it is, and your chance of mortality is very mere. It may be 0.3%, or 0.2%, or 0.1%. Even though the particular professional can't able to cope up or to understand or to cope with that particular situation, and they had committed suicide. So that all thing is a sad incident. But even though this is the condition of the system where which we are living or which we are practicing, so that also has to be in the consideration when we are planning burnout management or the self-care management or to overcome this particular pandemic situation. It having multi-dimensional roles. How an individual or how a health professional can manage, that is purely based upon their social support system. The social support system comprises not only that self, it is composed of their family, their community, their colleagues, their peer group, their friends. Even your pet dog will contribute to the thing, or the pet cat will contribute to that psychological well-being, or that, but in the coping strategies or your hobbies, or how you are managing in the home, or what is your domestic environment, that everything will contribute to your psychological well-being. That all together will help you to overcome this particular COVID situations. Then we are talking about the exercise. Naturally, we have gone for this thing lockdown. Even in uniform, we can come outside. We can only practice the indoor exercise and everything. Outdoor exercise there will be chasing with the local police. That is a scenario which we are facing here. And the sleep hours. and it is very easy to advise. You go for sleep for 8 hours, and practically it is not possible for at least 80% of staff, those who are working in the clinical administration or the clinical managerial level. And it is possible for when the hierarchy comes down, the person those who are in the lower strata, they are physically exhausted and they are like depleted, but that sleeping, insomnia, that everything will be common in the lower strata and the middle strata and the upper strata. That in pandemic situation, it is like everybody is affecting the same situation one or another way. And you can engage in hobbies, but naturally, how far it will help, it is a question mark only. But it is very easy to advise. You can engage with something that will help you. And the safety guidelines. There comes down the when we want to follow the safety guidelines, that initial day, when I had seen that first PPE kit, I was having the curiosity how to use it. I'm ensuring that last button also in my dress, it has to be properly tied up, it has to be knitted properly, and it has to be covered everything. As days goes on, the hours of usage, if it is going 6 hour, 10 hour, 12 hour in the PPE kit, multiple time we are changing, and the safety guidelines which we are supposed to follow is being compromised, either because of we may be versed with that situation, or that common Indian culture, "Hey, chalta hai," that attitude also sometimes it may contribute to that one. There is a compromise in the safety guidelines, that everything will contribute that like a stressor. And the data shows enough in-house research data what it is shows and everything. In our total staffs, more than 35% of the people has already got infected with COVID-19, even though using all type of safety guidelines. And there may be some error in by using the personal protective equipment and everything. But that safety guidelines, that implementation or the following of safety guidelines will be a question mark. Once you have got infected, like an attitude, I got already infected with COVID, then why I have to use the PPEs, or why I have to use the personal protective gears? So that also it is an important role, how you have overcome or how you are perceiving that threat. So that threat is now COVID-19. That threat has been overcome. So now, anyway, my time is over. I have already been undergone that COVID experience. Then there will be antibodies. Then why I have to use the PPE kits and everything? So that is also gives on board or a compromised situation in the hospital environment. And lifestyle changes or the family adaptations. So this is very critical. This without the family support, without the social support, is very difficult to manage this particular situations. Okay. Next, for the resilient formation, one important thing is work-life balance. The concept of work-life balance, everything it has came through a Western health system. And Indians, it is like a place where we are working for 8 hours, or where we are working for this thing 10 hours, or we are working for the 4 hours. And the people are more concentrated on that particular work. They indulge their full mind, everything into the particular work. And plus, there is a habit that take home. It is not the take home salary, it is a take home work. That is also an Indian culture, what we are seeing here. We are taking all the burden from the workplace and we are dumping into the home. We are spoiling the working environment, taking compromising. We are taking the work to the home. There also we are spoiling the life, and we are not enjoying our Saturdays. We are not having the culture of weekends. In India, there is not much concept called weekends. Our weekends are Sundays for an office jobbers. But in Western culture, weekend will start from the Friday evening. It is continue up to that Monday morning. That work life, what they are supposed to do, they used to complete, and they are going for the more liberalized time or a happy time with the family and everything. In this pandemic has created that particular work life balance has been spoiled like anything, and many are facing, and many are not. They may have not seen. Even I can say tomorrow is Sunday. Okay, I know tomorrow is Sunday, but still that particular work is going on. I have to complete my work. I have to finish my surveillance activities, and I have to tally my patients. I have to see how many people are moving. That everything has to be reported to the community. That means the local administration or to the higher ups, and many are seeing the newspaper and having a cup of tea, and they're watching that COVID status, and they are seeing that how many days that everything has been originating from a hospital or a setup. They are the people, they are dedicatedly working for a particular work, and they are doing it 24/7. And actually, it is not a good healthy habit. But there comes one question that is called a delegation of responsibilities. All nurses can understand that thing when we are studying about the stress management, or when you are talking about the psychology, they are very well. What is the delegation of responsibility? Or in administration chapter, when we are talking about the administration, it is there delegation of activities or delegation of the job responsibility. This delegation of activities, if we are not doing properly, that itself will cause a major trigger for a stressor, or it itself a stressor. I am the person. I have to do everything. I have to do everything. So I am the only person can manage and everything. So there will come the Zeigarnik effect. So this unfinished task, that means that assigned task is only for myself. So I am responsible to that 100% of work, or I am responsible for that 100 work. That also will affect a normal mental status of an individual. But even though in our scenario, in like a pandemic management, it is a very bad habit, but even though many are carrying and many are following that thing, then these are the things which we are facing commonly during the pandemic management, or the common stresses what we are seeing and everything. Then comes to an important thing, how the day-to-day activities of a healthcare professional. Now, what we are saying first, so you are leaving the home, you are coming to the hospital, you are wearing your PPE, you are triaging your patient, and you are going back to your home, and you are discussing all the information to your family members, and it is like a way of ventilation also. So what you have seen here, what you have done in your hospital, and what are the adverse situations you are seeing, that everything you are ventilating your colleague, or ventilating your spouse, or your friend, or your family member, whoever it is. So that also itself will give on psychological well-being, or it also will help to ventilate your psychological stress factors to a certain extent. So that also will play an important role. And rather than thinking I myself, it is a system, so which runs and which help us to overcome the process for the particular burnout, or particular creation of a resilience, how to tackle this pandemic situation. It is like a combined activities. Then there is a positive aspect of a pandemic. So how we have overcome this pandemic situation, it enables our health system to manage or to prepare a health staff. For example, we have seen that astronaut, they were in that in health professional, we can say they were in a modified PPEs. In that modified PPE, that concept, even that term PPE, even my junior just they have passed out and they joined the service and everything. They'll ask, what is this PPE? Whether I will die inside, or whether I will get any this thing cardiogenic shock. That are the questions that people are asking. What is this about this cardiogenic shock? Wearing this PPE, but they don't know what they're telling, what they're yelling. We don't know, but they're having on fear. Right? This is something like one igloo is coming, or an astronaut is coming, or it is like a what you can say, it is like a mountaineering what we are wearing that all that woolen clothes and everything. So that scenario is over. Now health system is adapted. They had seen the worst, or they are going through a worst scenario. This just helped them. Help them. Suppose if we are facing in from 2020, or sorry, up 2030 or 2035, if any new pandemic, it should not happen. But suppose if anything happens wrong, now this healthcare professional, which they had seen what was managed in this particular pandemic, they help or they guide, and they can think or they can act how effectively can be done the surveillance activities, or that control of this thing, or the community aspects, or the here the community plays also an important role. For example, so there was two outbreaks in Kerala. I don't want to mention about which outbreak. It is very much contradictory and everything. It has happened in Kerala around 2 or 3 years before, and the particular state where we have having that primary healthcare system or the community system is exceptional, as par with any European countries or the top number one in the European countries. Their health system is as par with that health system of Kerala, and they have tackled that particular viral or that particular outbreak effectively, and it has become a localized infection or a localized situation, and they have managed that one. It has not grown to a level of a pandemic. It was just like an outbreak. They have managed that outbreak. So that entire system, entire healthcare system, which is involved in that particular area that has been acted like anything, they know how to tackle because they have learned from that experience. That gained experience has created a positive resilience among the particular health workers of that are working in that particular area. That has helped them to overcome, to manage a bigger level, and we can say it is like a test project to a broader project, or we can say it is like a small that like a toy piece to an atom bomb. So you are familiar in that some situations, and if that bigger situation comes, you can effectively manage. They have proven it. And the health parameter, when we are comparing with all that health situation in India, that health parameter like death rate, mortality, and the transmission, community transmission prevention, that one particular place where managing nicely because they are already experienced, or they are sensitized, or they have got the vaccination, not in that aspect, and they have got that antibodies or their mindset. That particular antibodies, we can say, that is called resilience. Or you have undergone that particular situation, you have developed that confidence, and you have gained that confidence, how you can tackle the situation, that everything they have developed. So that also has helped to overcome, or that resilient character, or the resilient behavior, or that coping mechanisms that has enabled the health professionals to overcome that new situation. Anyway, this is irrespective of the state, irrespective of the country, irrespective of the type of health professionals, everybody is working together. Everybody has seen the situations, and everybody is undergoing the situation, and we all are in the middle of pandemic. And the initial stress, what on the patient, suppose the patient arrive in an emergency department with the COVID symptoms. The first patient what we have seen, and the patient those are coming now, we are having more confidence when we intubate a patient, when we are just about of intubating the patient. So initial days there was a fear factor. What will happen to me? That question was there. So that itself is stressor. Now I can intubate. I'm using my all PPs. I'm using my self-protective gear, and I know the technique. I know the complications. What will be the outcome? That everything I have got up to a certain extent. So that also has helped. That has made, or that resilient behavior has helped, or that adaptation or coping, whatever it is, that psychological things. But a resilient character has formed. So that has enabled us to overcome the particular situation, or we are overcoming the situation. But now we are talking about the second wave. We are telling, okay, you have got astonished of second wave is coming, but second wave also is going, and we know this will go. And third wave they are expecting. Anyway, that first wave and second wave, what they have made and what they had left, that everything is, it is enabled, or it is given some sort of antibody creation. It's a psychological antibody. So that also helped us to overcome this particular situation. So this is one I just want to discuss about this particular pandemic situation, how our health system is developing. And for example, like oxygen, we are consuming hardly around 60 cylinders of oxygen for a week. 60 jumbo cylinders of oxygen we are using for a week. Now we are using around 60 cylinders of oxygen, maybe for 16 hours or for 18 hours. We are consuming that much of oxygen. The demand has been increased, and the production has not been increased, but that supply chain has been activated. I'm working in the railway service, so our department, like we are only that running the trains and everything. So whenever we are in need, our departments like transportation, like traffic, operating, our commercial, our mechanical department, all people, it's working like it's strings in the chain. So they're working together. What we want, if I want, I'm getting the oxygen from Bangalore, suppose on container shipment as scheme. They are chartering our train services. It is bringing to our place around 440 kilometers from the Bangalore. They are bringing the material, and that system has adapted, and they understood what is this and what the outcome and what the positive things they can contribute. That everything has helped. So the resilient nature of not only the health professional, the entire system, the entire healthcare system, or the entire community system, which is related to the health, that everything is working harmoniously to overcome this pandemic. So it's a resilient behavior has happened, that is 100% sure it is happening, and we are facing. But a minority of staff or the health professional still facing a psychological, what we can say, that like a acceptance. The level of acceptance is not, or the coping mechanism was not developed and we are such a level that it can be managed well. And obviously we are forgetting about our family members, the healthcare professionals, so indulge their life in that pandemic and everything, their tension, stress, and their family members, they're going for the patient care, and what will happen to them, that everything also will be affected for them. So it is like a all sort of a refreshment to a healthcare system. It has triggered many things. It itself has balanced, and it itself has found out a lot of solution. How other resources can be utilized for this pandemic. That everything has changed. So it is a not only an individual. It is a resilient characteristics, or the, like you can say, it is like a renaissance of entire system. So that has helped us to overcome up to a certain level even this pandemic things. Okay, Ms. Ambly, these are my views, things regarding this COVID-19, or how we have overcome this managing thing.
Thank you so much, sir,
Okay.
thank you, sir, for accepting our request.
Okay.
And in invitation, you already accepted for spending few times with us.
Okay.
And Parallel Institute of Nursing, Bharat University. I'm
Okay.
really thankful to you, sir, and
Okay.
great gratitude and thanks to you, sir.
Okay. Thank you very much for giving an opportunity.
Thank you, sir. And my special thanks to Ravindra, sir, our principal, and my HOD Abhay, sir, for giving me a chance to conduct webinar.
Okay.
And our token of love will deliver to mail, sir. It
Okay.
will be reach after this webinar. It will be you can able to receive in your mail, sir.
Okay, thank you. And it will be a more happy, and this is like it's a proud moment of myself. It's like a personal accomplishment that you know better. You're one of my first student during when I started my teaching career. You're one of my first student, so it's like a proud moment sharing a platform with my own student, and they were in a perfect place and everything, and they are teaching them this thing. And actually, I'm very much interested for the clinic. This thing, teaching as per clinical, but whenever the tug of war has happened, I choose their clinicals and just left that but teaching profession, but my students, so there are many are there in the teaching and everything. It is like a happy, or that like a, it's like a joyful moment as a teacher.
Thank you, sir.
Okay, all the
Thank you,
best.
sir, once again. Thank you, sir,
Okay,
for
thank you.
doing the session. Thank you,
Okay,
sir.
thank you. My sincere thanks to your principal. Sorry, I'm forget the name and everything. Your principal, your head.
Sir, Dr. Ravindra Ilchan, our
Okay, Dr. Ravindra sir, thank you very much for providing that as an opportunity, and for the Parallel University also. It's like I'm very much glad that you're providing me an opportunity to express what we are facing in the current scenario. At least it is reaching for one or two patients, but we are facing the scenario. It will be helpful, and a healthy and a wealthy and a prosperous all health professional. That is our thing, and particularly for the nursing department, the nurses are contributing the much, and 90% of the pandemic management is doing by the nurses. We can say we are the backbone of the system. I'm proud to be a nurse, and same to you, sir.
Thank you, sir.
Okay, thank you very much. Thank you. Okay, we'll play the call.
Yes.
Okay.